Well, that's a hard number to come up with precisely. As you know, there's a rapidly increasing percentage of patients in developed countries who have diabetes, particularly in the age range where you're at risk for aortic aneurysm disease. And I don't know exactly, but from some data from some European registries recently, perhaps as many as 20% or more. Well, there's many different impacts of diabetes on aortic aneurysm disease. Diabetics are less likely to have abdominal aortic aneurysm disease. When aortic aneurysms are present, they grow less rapidly. They're less likely to rupture. And following surgical repair, they're less likely to require secondary intervention. So in fact, there's a broad impact of diabetes on almost all aspects of aortic aneurysm disease. So that's an excellent question, and that's what I'm focusing my talk on here today at the Veith meeting. Primarily, I think we have to think a little differently about indications for intervention for aortic aneurysm disease, because as we know, diabetics are going to have limited life expectancy for reasons related to diabetes. And if the aneurysm disease is less aggressive, grows less rapidly, less likely to rupture, etc., perhaps we should rethink a little bit our indications for intervention in diabetic patients. Maybe in older diabetics, maybe wait till the aneurysms get larger, different threshold for surgical intervention in diabetics versus non-diabetics at any given aneurysm size. Yeah, so it turns out that at least in the perioperative period, outcomes are similar. But again, because of some of the issues with end organ complications related to diabetes, we do have to be concerned about the presence of silent coronary disease and other issues like that. But I do think that with appropriate risk factor modification, perioperative management, I don't think the surgical outcomes, at least in the immediate 30-day period, should be significantly different, with some potential exceptions. But I think, again, more importantly, the idea is how the diabetes impacts the long-term natural history of the aortic aneurysm disease. I think that's where we need to focus.